Hi everyone, Dr. Jeff back with this week with co-host Kelly. Hope you enjoyed last week's video, and I think we're tying things in this week. What are you doing this week, Kelly?
Yeah, this week we're going to be talking about carpal tunnel syndrome. So last week we talked about poor bone posture and how when we have those symptoms, it can lead to carpal tunnel syndrome. So why don't you elaborate? What is carpal tunnel syndrome?
Well, carpal tunnel syndrome is a condition that your hand starts to get tingly and numb, especially your thumb and these three fingers here. Really those two fingers and half of that finger. Kind of mostly you feel it at night. A lot of people wake up and their hands kind of tingly and numb and they have to kind of shake it out or they lean it off the bed. And it can actually lead to a little bit of a loss of grip strength as well.
Absolutely. And what happens during carpal tunnel syndrome is that your median nerve, which starts all the way in your armpit and goes all the way down to your hand, there is compression or pressure along that nerve. And at any point in your arm, if you have that pressure or compression, it can lead to any of the symptoms that Dr. Jeff just said.
Carpal tunnel syndrome was always thought of being a wrist thing. You have this ligament around here called the carpal ligament, and through here, the median nerve comes down and runs through this area. People that do lots of typing or overuse with their hands, what happens is the swelling gets into that tunnel that median nerve goes through, pinches off the median nerve, and you start to get these symptoms. A couple ways we can treat this. One way is with surgery. That's kind of one way you go about it. With surgery, what they do is they kind of slice that carpal ligament open. That reduces all the pressure on the nerve. Pretty well right away, the hand tingling and numbness goes away. Your grip strength kind of comes back. The problem with that is that ligament, where they cut it, will scar over and produce fibrous tissue. That fibrous tissue can adhere to the tissues underneath, and generally these people down the road will have to have surgery again because all that happens is that fibrous tissue adheres to the median ligament or the median nerve and causes the condition all over again. It's only about 70% successful in solving your carpal tunnel issue. The non-surgical way is more a physiotherapy or way, and that's because, as Kelly mentioned, the median nerve kind of starts up here, and it can get trapped anywhere along here. So what we really have to do is we have to track that nerve down. So with ART or other myofascial techniques, we have to look through the bicep, through the triangle in here, down through here, and see if the nerve is being trapped anywhere else. You know, if you had an injury to your bicep, or you have a golfer's elbow or something like that, that can actually lead to carpal tunnel syndrome. And the problem is not actually down here. Right, the problem's coming through here, so we have to track that nerve down. Here at the office, we have something called a carpal tunnel distraction machine. What it does, it actually pulls on the wrist in different directions to open the tunnel up, create more space in it, and that can relieve your symptoms. But also, we're going to track the nerve all the way down through here to relieve it, and that's why our treatments here are about 90% successful in getting rid of your carpal tunnel syndrome.
Well, so a little bit of history about our CTD machine is that back in the 90s, we had a chiropractor who actually had carpal tunnel syndrome himself. And so he designed this machine to create and mimic what a physical therapist would do to someone who actually has carpal tunnel syndrome. So this machine would kind of traction and pull on that wrist to create that spacing and to relieve some of the pressure here. And so there's only about 12 of these machines in Ontario, but we have one of these machines here in our clinic. So now we have Dr. Jeff strapped into the machine. So this is what our machine looks like. We have the straps around the arm, the elbow, but we have one primarily on the wrist. Because we are strapped in at the wrist, the machine is going to traction and pull onto the wrist, relieving some of that pressure that is caused by the pressure in the ligament. So by stretching that ligament, we can relieve some of the pressures and symptoms from carpal tunnel.
Yeah, so it's going to actually pull me out for about 5 seconds, and then it releases. So it's a pulse type of traction, so it doesn't pull and just hold it, but out and back every 5 seconds, and it goes for, say, about 1:45.
Yep, 1:45.
And we're going to do it in 3 different directions. So we're going to go straight out, and then we're going to pull me this way, and then we're going to pull me that way.
Well, now we're going to click start. We'll show you what it looks like so you know what to expect if you ever needed to come here and try out our CTD machine.
So it pulls it out, and we can actually set the pressure depending on how big you are. And the whole idea is it's not supposed to be painful.
Yeah.
So it pulls it out for about 5 seconds, it releases it, comes back, and we do that going straight out. We do that for 1:45, and then we turn it. So you go in a different direction.
So now that we have this angle turned in, we are stretching the ligament in different directions to get an equal stretch. So after a minute 45 seconds in one direction, we'll try and move it. So notice that the bar is now horizontal and that the machine is going to pull Dr. Jeff's wrist in another direction to give that equal stretch to that ligament. So if we were to click start, it would be the same thing. Pull for 5 seconds and then it would be a release in 5 seconds.
All right, so now my wrist is being turned. I keep my thumb up and you can see that my wrist is being turned to the inside. So again, we're trying to stretch that ligament in a different direction.
Well, thank you so much for watching our video this week. Well, you hope that if you have any of these symptoms of carpal tunnel syndrome, that you come on in, try out this machine, try out some of the other modalities and therapies that we can do to help you. And as always at Goldsworthy Chiropractic, we got your back.